Good afternoon, everyone. Welcome to today's Board of Health meeting. The Public Hearings Committee will, of course, follow Public Health beginning at 3 p.m. And a special council meeting will proceed directly following the Public Hearings Committee meeting. With that, I will call to order the Board of Health. Are there any other additions or changes to the agenda? Seeing none, if I could have a motion to approve the agenda as presented. Member Taylor, seconded by Member Van Passen. All those in favor? That's carried. Any declarations of pecuniary interest? Okay, seeing none, we don't have any consent items on the agenda today, and so we will be moving right into our presentation from our Acting Medical Officer of Health. Welcome, Dr. Strauss.
Hi, thanks for having me. Always a pleasure to speak to the board through you, the board chair. I regret that I couldn't be in person today. I was really looking forward to finally meeting those of you I haven't met. I gave a report to the Health and Social Services Advisory Committee just last week. So in the interest of not committing redundancy, my report to the Board of Health currently is the same as that given to them. So that's on your agendas. I will run through it quickly, and I will share my screen so that we all have, actually I'm going to hold off on that. And just pull up my report. So the headline is that the sixth wave in Ontario appears to have crested. Whether it has peaked or merely plateaued remains to be seen. Since the figures that I had put on for the Health and Social Services Advisory Committee, things seem to be flat. So hopefully that's clear from the graphs in your agenda that cases seem to have gone down, but hospitalizations have not yet gone down. Incredibly, I think this is the third year in a row where we saw a wave peak on or around April 20th. So very suggestive that it always has been suggestive that there is a fair amount of seasonality as to when these waves occur. But further reinforcing that idea, I think we can be hopeful for a good summer. This sixth wave, which has now plateaued, as I described, by far and away was the least deadly in Haldimand and Norfolk of the six waves. For this, we can thank the vaccine rollout, burgeoning natural immunity from previous infections, and the decreased severity of Omicron. I do believe the cause of this wave was the BA.2 variant of Omicron, which is 50% more transmissible even than Omicron, which was much more transmissible than the variants that preceded it. And I think the other major headline is I'm just so pleased and delighted to report that our advocacy on the subject of local Paxlovid availability was successful. I don't have precise numbers as to how many residents in our community have received Paxlovid, but just in speaking with local physicians and community numbers, I know that it is quite a number of high-risk community members who've received that drug. So I really want to thank the Board of Health for aiding in those advocacy efforts. Like I said in my email to the board, I really think you've made a difference, and that difference may be measured in terms of lives saved. And then lastly, it continues to be the case that overall COVID-19 mortality in Haldimand and Norfolk is declining relative to neighboring and comparable health units. So perhaps I will share my screen for that, so we're all looking at the same thing. Share window, PowerPoint. So I started showing these around the March, around the time of our February meeting, I believe. Haldimand and Norfolk is always in purple. So these are the 4 health units surrounding Haldimand and Norfolk: Hamilton, Niagara, Southwestern, and Brant. As you can see, we are 4th out of these 5 comparables for total COVID-19 mortality. And here we are 5th out of 5 comparable rural public health units, which I think we can be pleased about. And as previous, I really credit the local community as well as the Board of Health for their courage and common sense approach to this pandemic in causing this relative decrease in COVID-19 mortality that we've seen over the last little while. So that is the end of my presentation, and I'm very happy to hear any questions you might have pertaining to it. Thanks.
Thanks, Dr. Strauss. Any questions from the board members? Member Vanden Riche, go ahead.
Thank you, Madam Chair, and through you, I hope I'm close enough. How does one doctor use the data if people don't report? In the first wave, second wave, third wave, fourth, we didn't hear of a lot of people that had COVID. Now we hear everyone's had COVID. Many of us family members have COVID. It's ongoing, but they don't pick up the phone and report to the health unit. So how do we use that? How do we know that your data is fairly correct?
Thank you for the question, Councillor Vanden Riche, through the board chair to you. I would say that the case numbers, we talk in statistics about accuracy versus precision. So if we're accurate but not precise, if it's the case that we're getting the if there's some constant in terms of what proportion of people are reporting their case, but not everyone is reporting, you don't get a precise number, but you can see the trend. So that we believe that you can read the trends, but you might be missing out on what the absolute number of people with the case are. Case numbers have always been a little bit suspect, because even in the very first wave, you may remember folks were told we don't have enough tests. If you feel sick, stay home and just go to the hospital if you have trouble breathing. So we may have missed a lot of cases in that first wave when testing capacity was not scaled up yet. And that's why throughout the pandemic, I and many others have been advocating that we really need to follow hospitalizations and deaths. And it just is the case that if you're in a hospital, you're getting a COVID test if you have symptoms. And so that number is both accurate and precise. And of course, I believe the deaths number is also accurate and precise. Although with, again, the caveat that earlier in the pandemic, everyone's hair was sort of on fire in terms of data collection. So any death within 28 days of a COVID-19 positive test was considered a COVID death, whereas now the ministry is able to collect is able to have more of a review of the death done, so that if you have COVID but you get hit by a car, that doesn't go down as a COVID death. I'm happy to say that because Haldimand Norfolk is relatively a smaller health unit, every COVID death, both during my time and during my predecessor's time, was personally reviewed by the medical officer of health. So in terms of our death rates locally, I have a high degree of confidence in that because it's had personal MOH review. Thank you for the question.
Follow up. So at the end of the day, I think I'm just kind of looking for the fact that some people are still continuing with safety measures, some restrictions, some whatever, because there's so many people, in my opinion, that have it or had it, and that we're running into people more. Is there any recommendation from the health unit of a continuancing of keeping up vigilance? Not, if you are in a huge crowd, say if you do go to a significantly large sporting event or whatever, that masks are still recommended?
I would follow one piece of advice that I believe the Chief Medical Officer of Health and ministry officials have given, that we are at a stage where we have to do more of our own personal risk evaluation, rather than this idea that one size fits all, that everyone should undertake the same precautions. I am of the view that if you are up to date on your vaccinations, for many adults that means 4 doses, for others it means 3, and you are relatively healthy, this is an extremely low risk disease to those individuals. So in terms of those individuals doing their own personal risk evaluation, I don't think that they should be avoiding any activities. If you are someone who, for whatever reason, has chosen not to be up to date on your vaccinations, or if you have very, very significant comorbidities, such as significant immunosuppression, and that means that you have some sort of blood cancer that is like leukemia that is causing you to be immunosuppressed, or you're receiving immunosuppression from a rheumatologist or a cancer doctor, then you probably, in consultation with the doctor who has declared you immunosuppressed, should be discussing your personal risk mitigation strategies. So a kind of a long answer, and that's about as much, from a public health point of view, that's as much personal risk advice that I can give. But I, again, would be in concert with the ministry. We need to start thinking about our own health. And if you are a perfectly healthy person who's up to date on your vaccinations, I think that you should return to life as normal.
I think personal choices then. Thank you.
Thank you.
Further questions from board members? Oh, Member Rabbits, go ahead.
Thank you, Madam Chair, and through you to the doctor. My question is surrounding Paxlovid, hope I'm pronouncing that correctly. Some major news that the Vice President of the United States had contracted COVID-19 and was actually prescribed this medication. I was just hoping for a little bit more information on Paxlovid. Does it require a prescription? And how is the effectiveness of this treatment being recorded? And what information could the Board of Health expect back once we have a little bit more data in terms of how this treatment has helped reduce death and hospitalization?
Thank you for the question. Through the board chair to you, Councillor Rabbits. I am pleased that it is the case that residents of Haldeman and Norfolk who contract COVID can receive the same standard of care as the Vice President of the United States. So I think that's really remarkable, and I'm happy that that is the case. Have I frozen?
It looks like it's just me on the camera. We can hear you.
Okay, great. I can turn my camera off if we have continued difficulties. Where was I with that? So the reason I was so excited about Paxlovid is the randomized control trial, which was done. Randomized control trials being the gold standard for how we make medical decisions. The trial was published in the New England Journal of Medicine, which is really the gold standard of peer-reviewed medical publications. In that trial, they found that if you receive it within 5 days of symptom onset, it cuts your risk down of going to the hospital by 90%. And although it wasn't statistically powered to look at mortality, it showed that there were 0 deaths in the group of people who received the medicine. In contradistinction, I think there were 12 deaths in the group who did not. So it's an incredibly effective medicine. Yes, it does require a prescription. So the best way to get it, sorry, and the other thing to remember is that it is only for high-risk individuals. And maybe I should have mentioned this in response to Councillor Van Rieschi's question. If you're fully vaccinated, in general, COVID-19 is about as risky to you in terms of hospitalization or death as influenza. So if you're a healthy 25-year-old who is vaccinated and you get COVID-19, the treatment is chicken noodle soup and ginger ale. If you are someone who has important medical problems, advanced in age, or not up to date on your vaccination, so 2 of those 3 things: important medical problems, advanced age, not up to date on your vaccinations, and you get symptoms of COVID, I want you to have a test, and then I want you to see a physician or nurse practitioner so that the medicine can be prescribed. It can be your family doctor. It can be an urgent care clinic. It can be the emergency room. I do believe that the COVID assessment centers in Hamilton and Kitchener are no longer seeing folks from out of town. And now, as far as I can tell, our family doctors in this community, I'm pleased to say, are quite on the ball and are interested in making sure that the patients get the medicine in a timely manner. In terms of statistics for how will we know the impact of Paxlovid locally, unfortunately, that is not something that the public health unit is able to track. These prescriptions are between the care provider and the patient, and we are not prescribing this medicine because, I mean, I believe I'm the only prescriber who works at the health unit, and I can't see every case of COVID. I do believe that Public Health Ontario and indeed the national public health agencies will be doing statistical analyses of this medicine, but it's rather out of the hand, or it's too big of a job to do that sort of drug efficacy monitoring for a local public health unit. So we will not.
Any further questions from members of the board? Yeah, I don't see any more. Thanks very much, Dr. Strauss, for joining us today. If I could have a motion from the board to receive our medical officer health update as information. Member Huffman, seconded by Member Taylor. All those in favor? That's carried. Moving on to the approval of minutes, we have the board minutes from April 5th, 2022. Are there any errors or omissions? Seeing none, if I could have a motion to approve the minutes as presented. Member Taylor, seconded by Member Martin. All those in favor? That is carried. Communication items 8.1 registration is now open for the 2022 annual general meeting conference section meetings and optional pre-conference workshop. Heidi, I believe you're going to speak briefly to the communication item.
There we go. Thank you. Sorry about that, Chair Chop. Yes, I just wanted to bring this to the attention to the Board of Health that the annual conference for our Provincial Public Health Association is coming up. If there are any Board of Health members that are interested in attending any of the conference or the workshops, please feel free to reach out to me, and our office is happy to facilitate your registration.
Okay, thanks, Heidi. If I could have a mover and seconder to receive the item of communication. Member Taylor, seconded by Member Martin. All those in favor? That is carried. And back to you, Heidi, for the Ontario Seniors Dental Care Program, the request for proposals HSS 22-010.
Thank you, Board Chair Chop. Through you to members of the board, Ms. Kike Ogunsalari is with us today. She's a program manager with the health unit, and she's going to be presenting this report.
Thank you, Heidi. Good afternoon, Madam Chair and members of the board. I am presenting report number HSS 22010 which is a request for proposals for the Ontario Seniors Dental Care Program. The Ontario Seniors Dental Care Program was introduced in the 2019 provincial budget to enable financially challenged seniors access dental care services at little or no cost to them. The main objectives of this program are to prevent chronic disease, reduce infections, and to increase quality of life while reducing the burden on the healthcare system. The program is 100% funded by the Ministry of Health and does not require a levy contribution. The OSDCP was officially launched by the Ministry of Health on November 20, 2019 by opening the enrollment process to low-income seniors. The Ministry of Health also provided our health unit with a one-time capital funding for enhancing existing infrastructure in the Donville and Simcoe offices to increase the clinical spaces and capacity to provide preventative and therapeutic oral health services to the eligible seniors. In September 2019, it was confirmed by the Ministry of Health that the Board of Health may enter into partnership contracts with other organizations or service providers on an hourly, sessional, or per diem basis for the provision of the dental care services. A modified request for proposals was developed and issued to the marketplace, and contracts were executed in mid-November 2019 with 3 providers from December 2019 to March 2021. In February 2021, staff completed a modified procurement process in accordance with the county's purchasing policy, seeking proposals from qualified dental professionals within the Haldimand and Norfolk counties to provide dental services for the program. Contracts were executed at the end of March 2021 with 4 providers for the period of April 2021 to December 31st, 2021. The contracts were further extended for 6 months till June 30, 2022. The health unit office in Simcoe still does not have the necessary infrastructure to implement the seniors dental care program. This is mostly due to construction delays as a result of the COVID-19 pandemic. Construction is planned to be completed at the end of August 2022. In conclusion, staff are requesting approval to permit a modified procurement process, seeking proposals from qualified community dental professionals for a period of 6 months, with an option to extend the agreement on the same terms and conditions for an additional 6 months. This will ensure continuity of the implementation of the seniors dental program until construction of the dental operatory is completed. Thank you for your time, and I'm happy to answer any questions that you may have.
Thanks very much for your report. Any questions from committee? Member Van Den Riesche, go ahead.
Yes, thank you, Madam Chair, and through you to, I think Heidi, maybe this would be more appropriate for you. So the ministry offers significant amount of dollars, and is there a timeline that, like once we've used up their money, is there an opportunity to go back again to continue this program? Because to me, it's a start program, but it's something that could be ongoing.
So Madam Chair, through you to Member Van Den Riesche, the capital funding is one-time funding that we have been able to carry over. As was mentioned, there's been a delay in the construction and due to construction delays related to COVID. So the ministry has permitted us to carry over those capital dollars so that they are available to us to finish the operatory in at the Simcoe office. The operating dollars, this is a permanent program of the ministry, and as was stated in the presentation of the report, it is 100% funded. So it is a program that is part of our annual service plan every year with the Ministry of Health, and is part of our Ministry of Health funding.
And so once you've built this dental area in the at the office, so then and it's ongoing, so then people, instead of going to dentistries, will come there.
Madam Chair, through you to Member Van Den Riesche, and I would invite staff to correct me or add into my answer, but my understanding is that that is correct. We will be offering dental cleaning services in our office in Simcoe the same way we are able to do now in Dunnville as that capital work is complete.
Okay. Well, that's awesome. Thank you.
Heidi, just curious what other feedback we ever got from the ministry. So obviously they're allowing us to do this to extend with local providers, but it was clear that the Board of Health was interested at the time of just sticking with local providers as opposed to bringing that service in-house. Whatever became of the response from the ministry to that? Is that, I'm assuming then by this report that is not going to be permitted for any of the public health units?
Madam Chair, as that discussion was for my tenure, if I could defer to the staff who are on the call, if there are any more details, and if we need to go back and get more details for you, I certainly will.
Syed, do you have anything on that from at the time?
Yes, to the board chair, to members of Board of Health. So initially, ministry allowed us to go back to community dentists and then can have an MOU with us so that we can transfer eligible clients to them. But this model is very expensive to us. So what we shared with Board of Health is like at the end of this year, we are going to evaluate this this whole program, and then we'll get back to Board of Health again to ask for their permission if we can hire our own team of clinicians at the health clinic. And by looking at some of the lessons learned from the ministry and from other health units, so ministry is recommending some kind of a hybrid model where some of the services like examination, assessment, and some limited treatment can be offered in-house within the health unit. And for any specialized type of treatment, it can be referred back to community clinics.
I'm still a little bit confused because it was the direction from the Board of Health at the time specifically to request, and I feel like it could have been Councillor Taylor that put that motion forward, to ask them to allow us to use community providers. I mean, I'm sort of confused as to how that would cost us more than bringing it in-house. Some of the items that we've moved out of house, like the women's sexual health services to the Delhi Family Clinic, was because it was costing the taxpayers so much per visit because the services weren't being fully utilized in the same way that they might at a clinic that is offering other services. So where we had a nurse that would see a small number of patients, that nurse at the Delhi Walk-in Clinic would be seeing other patients for other matters throughout the day, and therefore it reduced the overall cost to the taxpayer. In the same context for dental services, I don't understand how bringing a program in-house, I think that was the question from the board at the time, was going to be more effective, especially when we look at the widespread distance that people would have to travel both in Haldeman and in Norfolk to be able to attend one facility versus having a couple of dentists throughout the communities that participated in this program. It also wouldn't require the hundreds of thousands of capital costs in order to establish this in-house. So at a time when we've moved things out of house, looking to save costs, I'm just wondering what the response was back from the ministry that the board had asked for, which was that we continue to provide this service with local dentists as opposed to bringing it into the public health unit.
So thank you, Madam Chair. So there are two things, ma'am. So the first thing is costing, like as per limited available data, this current model, that's very expensive. It's more than around, like on an average, $700 to see a client by a community dentist. So that is a way average than what a normal person can pay to see a dentist. So that is one thing. Secondly, for like why we went to build these clinics, because that was a one-time opportunity for us to gain that funding, and that helped us to build back better and modernize our already existing clinics that was utilized for Healthy Smiles Ontario, which is a program for children of low-income families. I want to quote one example. Is like in those days for Healthy Smiles Ontario clinics, the whole waste disposal that was done manually by the staff. So you can see the increased risk of infection spread. And with this COVID and by enhanced infection prevention and protocols, we would not have been able to open our clinics at all, even for children. So I will consider that an excellent opportunity which we availed so that we can build our like state-of-art clinics for the residents of Haldimand and Norfolk. But the plan was, and which was presented to Board of Health, that by end of this year, we are going to evaluate this program and then come up with the options and present to Board of Health, like which direction we want to move forward.
Okay, but that's a big cost to undertake, to bring in a capital cost to then evaluate the options. But I just want to go back to one comment you made. You said right now, out of house for an individual to get a dental cleaning is costing us $700 per person. Is that what you said?
So on an average, ma'am, including everything, as a process, like every person should be seen by a dentist first for an examination and assessment. After that, the dentist is going to refer it for depending on the disease. So as a whole, the whole process is costing us on an average $700.
Okay, so now I'm really confused. So Heidi, I thought this is for, we bring this in-house, do we have a dentist as well? Are we doing surgeries and these types of things? It's just cleanings, correct?
Madam Chair, excuse me, we do not have a dentist on staff. So we are doing cleanings. My suggestion would be that perhaps we can, the report that is before the board today is to do an additional RFP for external services. Perhaps my suggestion would be that we can take this back. I can work with Mr. Shaw and his team to bring forward to the next Board of Health meeting an information memo that will illustrate to the board the steps that the team has taken with the explanation from when this item came before the board previously to now, and what the plan looks like moving forward.
Okay. Yeah, that's fine to extend the, like, again, what you just said for what the report is asking for extending those terms for the local providers. I'm having a hard time right now, so we're clear with the $700 number. I think a cleaning is usually max like 200 at a dental office, so I don't know where that's coming from. But the bigger thing was the board wanted to know before we spend, and again, I get it's funding that's coming from the province, but it's still all one taxpayer at the end of the day. So as opposed to having that capital outlay and bringing that in-house when we've tried to move a lot of other services out of house because we saw cost savings there, what the board was interested in from the province was if they would allow us to continue outsourcing this as opposed to adding staff to Norfolk County. The other benefit of that, I think, goes without saying, again, is because we're covering such a wide area across Haldeman and Norfolk, wouldn't it be great as opposed to just Simcoe if one of the dentist providers in Delhi was able to offer that service? And, you know, then you had Simcoe and you had a couple of places throughout both Haldeman and Norfolk as well. So there wasn't just one option for people to be able to attend. So, yeah, Councillor Van Den Rishi.
Through you, Madam Chair, I would have to agree. I need more clarification here as well. The numbers do confuse me, but I have one question though. I understood, and I could have understood incorrectly, but you're telling me that Haldeman has already the infrastructure there?
So through you, Madam Chair, to Member Van Den Rishi, yes, there is a dental suite in the Dunnville office. There has been a dental suite in the Dunnville office prior when for the Healthy Smiles program for children. So this means that we can offer both of those services out of the Dunnville office.
So they're complete already.
That construction is complete, yes. I do think it would it could be helpful to the board, and we would welcome the opportunity to outside of this report today, come back with a more detailed report for the board about the dental program, outlining the average costs, where those average costs come from, and what the decision-making pathway has been like for this program and how we see it moving forward.
Yeah, I just hope that we don't, and I anticipate there could be a problem if one jurisdiction such as Haldeman has it already and they're using it, and we're just kind of waiting for it. There's going to have to be a little bit more, and I do agree, there has to be a lot more clarification here for me to understand the whole thing. I'm kind of getting confused. Thank you.
We'd be happy to bring back a more detailed report.
Okay, so as of right now, though, Councillor Van Den Rishi, what has been happening here is we are still outsourcing that service. So, and that will continue. That's what the report's asking for. And then Heidi would appreciate some additional information coming back. At the time, I believe Marlene articulated that there was some objection from the province to doing that. But the request from the board was to put it back to the province and ask, can we continue providing it this way? And then I don't think we ever got an answer to that. So with that, if I could have a mover for staff's recommendation, Member Huffman, seconded by Member Taylor. All those in favor? That's carried. Are there any other Board of Health general announcements today? All right, seeing none then, I would ask for a mover and seconder for bylaw 2022-07 BH being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this regular Board of Health meeting held on 3rd of May, 2022. Member Rabbit, seconded by Member Vanden Rishi. All those in favor? That's carried. And finally, a motion to adjourn. Member Huffman, thanks, and seconded by Member Taylor. All those in favor? And that's carried. So it looks like there's just over 20 minutes for a break, and we'll see everybody back at 3 p.m. for the public hearing.